How does axillary lymph node dissection affect breast cancer surgery? Imagine walking into a surgery knowing that part of the process helps doctors understand how the cancer has spread. That's what axillary lymph node dissection is all about. It's a surgical procedure where doctors remove lymph nodes from the underarm area to see if cancer cells have traveled beyond the breast. This step is crucial because it helps determine the stage of the cancer, which guides the next steps in treatment. When cancer has spread to these lymph nodes, it often means a higher chance of spreading elsewhere, so knowing this helps doctors plan the best course of action. During breast cancer surgery, especially when a woman is having a mastectomy or breast-conserving surgery, the surgeon may perform an axillary lymph node dissection if there's suspicion or confirmation that the lymph nodes contain cancer. Removing these nodes allows pathologists to examine them under a microscope to check for cancer cells. The results tell us whether the cancer is limited to the breast or has started to spread, which influences decisions about chemotherapy, radiation, or targeted therapies. However, this procedure isn't without risks. Because it's more invasive than a sentinel lymph node biopsy, it can lead to some common side effects. One of the most significant is lymphedema, which is swelling of the arm or hand caused by lymph fluid buildup. This can be uncomfortable and may limit our movement over time. Some women experience numbness or tingling because nerves can be affected during surgery. Reduced shoulder or arm mobility might happen, sometimes requiring physical therapy to regain movement. There's also a chance of fluid accumulation at the surgical site called seroma, or infections and delayed wound healing. Rarely, nerve damage can cause a winged scapula, where the shoulder blade protrudes abnormally. Because of these potential complications, doctors are increasingly cautious about using axillary lymph node dissection. Recent research shows that for women with early-stage breast cancer and only 1 or 2 positive sentinel lymph nodes, removing all the lymph nodes might not be necessary. Instead, they can often skip the full dissection and still have effective treatment when combined with other therapies like radiation and systemic treatments. This shift aims to reduce long-term side effects while still controlling the cancer effectively. Decisions about whether to perform an axillary lymph node dissection depend on the extent of the cancer and how many lymph nodes are involved. If multiple lymph nodes are affected, or if the sentinel lymph node biopsy shows extensive disease, a dissection might still be recommended. But for many women with limited nodal involvement, less invasive options are now preferred to improve quality of life. It's important to remember that each case is unique, and your healthcare team will tailor the approach to your specific situation. Always consult with your doctor to understand the best surgical plan for you, considering both the benefits and potential risks.